Definition: a nebulizer is attached to a flow of air or oxygen, converts a solution of a drug into an aerosol for therapeutic inhalation. Assessment: Number 1, evaluate patient's need for nebulization. Number 2, evaluate arterial blood gases, sputum cultures, and chest x-rays. Number 3, review the physician's nebulization order for length of treatment and medications to be used. And 4, assess patient's lung sound before and each after treatment. Objectives: 1. To deliver aerosol medications. 2. To promote a better ventilation, perfusion ratio by increasing bronchodilation and alveolar ventilation. 3. To decrease pulmonary edema. 4. To decrease the work of breathing. And last is to administer mucolytic medication to lower the viscosity of the secretions and aid expectoration. Special consideration: 1. The medication, as well as its administration by air or oxygen, is prescribed by a medical practitioner. 2. The procedure may be coordinated with chest physiotherapy and may be administered by a nurse or physiotherapist. And last, for a patient with asthma, an estimation of peak flow of tidal volume may be recorded before and after nebulizer therapy. Step number 1. Gather equipment. Check medication order against the original physician's order according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. These comparisons helps to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Step number 2. Know the actions, special nursing considerations, and safe dose ranges. Purpose of administration and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient, and perform hand hygiene. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder, and can also be used to educate the patient about the medication. Hand hygiene deters the spread of microorganisms. Step number 3. Place medication on a tray or move the medication cart outside of the patient's room, or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Step number 4. Transport medications to the patient's bedside carefully and keep the medications in sight at all times. Careful handling and close observations prevent accidental or deliberate disarrangements of medications. Step number 5. Identify the patient by checking the name and identification on the patient's identification band, or ask the patient to state his or her name. Identifying the patient ensures the right patients receive the medication and helps prevent errors. Step number 6. Explain procedure to the patient to gain cooperation and to allay anxiety. Step number 7. Fill the nebulizer cup with the ordered amount of medication. This ensures that the required medication amount is given. Step number 8. Turn on the air compressor to ensure the efficient vaporization of the medication. Step number 9. Observe the fine spray from the nebulizer to check that the equipment is working. Step number 10. Encourage the patient to breathe the nebulized vapor through the mouthpiece. A mask may be used if a patient has difficulty with the mouthpiece. Breathing through the mouth or normally with a mask helps the medication travel to the lungs for maximum effect. Step number 11. Remain with the patient until all the solution has been nebulized. Instruct the client to continue the treatment until he or she can no longer see a mist on exhalation from the opposite end of the mouthpiece or vent holes in the mask. Lack of mist ensures that the client has inhaled the entire dose. Step number 12. Encourage the patient to expectorate. Apply half-cuff technique could helpful Just sit upright, breathe 3 times, bend arms, raise elbows, and hold breath. Exhale forcefully, as the medication may help to loosen the bronchial secretions. Another technique which could be used is chest physiotherapy, which could facilitate expulsion of secretions to clear airway. Step number 13 ensures that the patient is left feeling as comfortable as possible. Bronchospasm is further reduced if the patient is relaxed and reassured. Step number 14 wash and dry the nebulizer, tubing, and mask or mouthpiece with warm soapy water. Proper cleaning decreases the possibility of pathogens entering the client's respiratory tract. Step number 15 retain the equipment in a polythene bag. For the patient's next administration, to prevent infection, the equipment should be changed every 24 hours. And for the last step, document the nursing practice appropriately, monitor adverse effects, and report any abnormal findings immediately. To ensure safe practice and enable prompt, appropriate medical and nursing intervention to be initiated.